Chapter 7. Let's chat about outpatient and primary care services. This is I don't want to say busy chapter, but there's a lot of information in this chapter, and there's 37 slides of this PowerPoint. So the learning objectives are listed. They're also in the book on page 269. Introduction, I'll let you guys read that. There's history there, what we used to do, what it's not working, and how we're going to move forward with outpatient ambulatory type ideas. So what is outpatient care? Outpatient care that services do not require an overnight stay in an institution. So literally outpatient, you come in and you go home the same day. So ambulatory cares would be considered diagnostic services like walking in to get a chest x-ray, labs, to see a foot doctor, that's ambulatory care. And again, outpatient services are listed here. It's not an overnight stay. That's discussed on page 270 to 271. Scope of outpatient services is on 271. Primary care is the foundation of ambulatory health services, but not all ambulatory care is primary care, so there is a difference here. Primary care is that primary care doctor we go to that person as a entrance, or that's not the word I'm thinking of. The next page where it talks about gatekeeping. So it is the primary entry point into our healthcare system. We don't ever want to utilize urgent cares or emergency rooms unless the urgent care is established as primary care also. So let me correct that, because that's a new thing that's come about in the past 5, maybe 10 years-ish, where local urgent cares, you'll notice that they actually do have a primary care provider in the building. But let me restate what I was trying to say. Our emergency room should not be used for primary care. It's not appropriate, it's not etiquette, and you're not going to get excellent quality primary care in an emergency room. That staff and those physicians, those providers, they're trained in emergencies. No, I could give you 100 examples. I'm not. But just believe me. And it's also in the book too, what I'm saying. Okay, scope of outpatient services. Primary care, yes. Services other than primary care are an integral part of outpatient services. So yes, the specialists like asthmatic doctors, cancer doctors, I can give you so many examples. They're still part of outpatient services, but they're not primary care. So keep that in mind. Primary care is the foundation of outpatient and ambulatory care, but they're not the only providers. Even eye doctors and dentists are part of outpatient services. Technology allows for treatments to be provided in ambulatory care settings. Yes, so even now today, gosh, it's been like this for 12, 15 years. If you need an MRI, a PET scan, CAT scan, that type of stuff can be done outpatient in these like mobile trucks that they have. You no longer have to go to the inside of a hospital to get that done. So pretty cool. Great advancements there. Table 7.1, that is on page 272 in your book. You can take time to look at that. Primary care discussion starts on 273. There is primary care. Obviously, it plays a central role, and it's distinguished from secondary and tertiary. So secondary care is usually short-term, sporadic consultations to get expert opinions. This would be like if you have an allergy issue, bug bite, you have to go to a dermatologist type of thing. That's secondary care. Tertiary care is more complex, and it's very, very specialized. This is post-care after you've had a trauma, a burn, babies that are born too early go in neonatal intensive care unit. That's tertiary care. And it's not common. Tertiary care is not for common issues. It's more specialized. Okay. Well, secondary care, I've already spoke to that. Tertiary, there's another slide for that. Healthcare service frequency. All right, so primary care, 75 to 85% of the population requires only primary care. That's a great stat to know. I actually didn't know that. I missed it in the book. I see it on the bottom of page 273. So that's pretty cool, because generally we are a healthy population that seeks medical care for just basic annual stuff. But then, like I said, secondary care is required for those with allergies, asthma, heart problems, obesity. My mind just went blank. Tons of reasons for secondary care. And again, tertiary care is for very uncommon things such as traumas. Not that traumas are uncommon, but to an individual, hopefully you're not having a traumatic accident every month. Burns and neonatal type issues, specialty. Let me go back. Another example of tertiary care could be, actually cancer could fit in both secondary and tertiary depending on the type of cancer. World Health Organization offers a great description on page 273. Point of entry is also mentioned on 274, where it states that primary care is the point of entry into health services. Gatekeeping implies that patients do not visit specialists and are not admitted to hospitals without first being referred to their primary care physician. So, interesting knowledge. Recently, I wanted to go to a pulmonary doctor just for some follow-up, and even though my insurance does not require a referral, meaning my insurance gives me the freedom to choose what doctor I want to go to. I can go to an allergist, dermatologist, podiatrist, and I do not have to have a referral. It lets me self-govern my own healthcare. But in 2022, this pulmonologist office will not see me unless I have a primary care referral. And the reason for that is because post-COVID, and still while some patients are suffering from major COVID complications, these offices are inundated. They cannot keep up with the demand. So I have to go to my primary care, get the referral before I book that appointment with the desired pulmonologist. And honestly, it's on my to-do list, but it's not a priority because, again, for me, it was just a follow-up. It's not urgent. Okay, so gatekeeping, we talked about. Point of entry, coordination of care, essential care. Coordination of care is on page 274, 275 for essential care. Institute of Medicine, IOM, they have their own definitions, and they're very similar to the WHO, or the World Health Organization. I'll keep going through here. Primary care and the Affordable Care Act. You can read about that on page 276. 277, we're talking about new directions in primary care. Medical homes, this is something that was created back in the 60s. A medical home consists of an interdisciplinary team of physicians and allied health professionals who partner with patients and their families. This talks about special needs populations. And these medical homes still exist. And they've now branched from, let's say, from someone who may be mentally handicapped at a young age with special needs to now even our dementia population who are suffering Alzheimer's, etc. They can go into these patient-centered medical homes. So it's not an institution like we used to have. For example, Dorothea Dix Hospital would have been a medical mental institution. It's more of a home. I've heard great things and I've heard horrible things, just like with any other type of healthcare setting, facility. If they're not monitored, certain things can occur and patients can be taken advantage of financially, mentally, physically abused and such as that. Okay, I flipped the page in my book. I am looking at, this slide is just a continuation of the new directions, primary care providers in the U.S. versus non-U.S. That's mentioned on 279 under community-oriented primary care. There are benefits to this, where it is population focused. I'll let you guys read that. I'm going to keep flipping. Growth in outpatient services. Yes, there's so many reasons behind that. It is not necessarily because it's cheaper. Let me just make that known. You'll read about that too, page 280 to 281. Outpatient does not equate cheaper. It comes to accessibility, it comes to technology allowing outpatient services to be provided, but definitely not, and social demands. You know, once people learn that you could get an MRI in the little bus that pulls up somewhere in a parking lot, literally, then that kind of changed the, you know, hey, I think, well, maybe I'll do that. Now that I know I don't have to go to an actual hospital to get it done, I really need to get my knee, an MRI of my knee or an MRI of my neck. The accessibility and convenience is determinant for the growth of outpatient services. Okay, so this is a great figure. This is on page 281 in the book. Types of outpatient care settings and methods of delivery. That is also, that is on page 282. Just keep flipping through the book. I'll let you review that. Freestanding facilities, retail clinics. This is a real thing. Your book describes this information for you. Home health services, hospice services. That has grown tremendously. Okay, this is old demographic information. 2013 is almost a decade ago. Estimated payments for home care by payment source. This is in 2014. So again, a little bit outdated, but Medicare is a huge payer and Medicaid. So look at that, those two comparisons there. So we're talking about government funded programs paying for the majority of home care. But many people do pay out of pocket, whether it's because they have no insurance or their insurance does not cover home care, or there's limits and limitations and expectations, etc. Oh, so these tables are in your book also. I'm not going to read them here. They're smaller. Take a look at your book. Types of outpatient care settings and methods of delivery. I feel like I'm kind of repeating myself here, but yes, this is nursing homes, case management, adult daycare. I don't feel like it mentioned. Let me go. I'm going to leave the slide as it is, but back on in your book on page 287, it mentions women's health centers. This became prominent in the 80s, and women's health centers came about for several reasons, but mainly because of the women are the major users in healthcare. They will go to a doctor more rapidly, willingly. They're more apt to seek medical care than their counterparts, and that's not bias. That's not what am I trying to say? Stereotypical. That's facts. So they money wise and providing care wise looked at the population and realized, hey, women really are our consumers, and so let's cater to that. And just recently in Raleigh, North Carolina, Wake Med Hospital System opened up a women's hospital. Wake Med already has the ER, their trauma level 1 trauma centers, stroke, heart. They even have a kids hospital, which, by the way, only UNC and Wake Med have a children's hospital in this area. I think Vidant. Oh, does Vidant in Greenville have one? Maybe they do. But my point is, having a women's hospital is a big deal for marketing, a big deal for appeal, a big deal for the community, and having excellent outcomes when it comes to women's health needs. Okay, I'm going to keep flipping in the book. All right, and then, yes, telephone access is a big deal when it comes to outpatient care. Here we go. So this is what I want you to take a look at and understand, because this is a big thing, complementary and alternative medicine, CAM, and it starts on page 300 in your book. This is not new. I would say this is actually older than our Western medicine. We are considered the West. If you look at a map, lay it out flat, we are the West. The East is obviously Asia, Australia, India, that whole side of the world. And we do medicine differently. And some of these complementary alternative medicines are old, and they were slightly dismissed in the revolution of healthcare, if you will, but they're making their way back, and there are some good outcomes. So I want you to read the chapter, familiarize yourself with this if you never have. It's great information. Utilization of outpatient services. Yes. Oh, where is that? I read that in the book. I can't remember off the top of my head, and my video is getting long, so I'm going to keep flipping through these slides. Yes. Primary care in other countries. This is important, just information-wise, to know how we do compare. And that was on page, there it is, 306 in your book. All right, and there's the summary, and it does this at the end of the PowerPoint. because the page. I'm trying to be quick. Let me know if you have any questions about this information, and I hope you have a good week.